So one of the most alarming trends we're seeing out of the pandemic is that our kids' eyes are changing at an even faster rate than what we've seen in previous decades. It's being called a myopia boom, and what's happening is kids' distance vision is decreasing at faster levels than ever seen before due to our increased indoor time and our increased use of screens and computers for learning and education. On top of social interactions and for fun. We're just not getting away from up-close visual activities nearly as often as what our eyes need to develop at a normal rate. Myopia, or nearsightedness, is what happens when we maintain good up-close vision, but long-distance vision gets blurry. And in kids, myopia is especially dangerous because we can change really, really rapidly in those years of growth. What's happening in myopia is the eye is actually too long, and that's what makes distance vision blurry. Now, as a kid, you're getting all of these growth hormones for your legs to get longer and your arms and hands and feet to grow. And so all of those growth hormones circulating in the body are also working on the eye, telling it to continue to get longer and bigger. And the added lengthening of the eye is what causes those rapid increases in prescription. In a kid growing between just those ages of 6 and 18 especially, average rate of change is 0.5 to 0.75 diopters of worsening prescription every single year. And as you can imagine, the younger you are when this condition starts, the higher your prescription is going to end up as an adult. Now, luckily, there are things that we can do, that FDA-approved treatments in both prescription eye drops and in contact lenses that can help slow things down. And it's very, very important to slow things down, not just to help get your very best visual clarity and help prevent yourself from getting a high prescription that would make things blurrier, but the health of the eye when you have a high prescription is at significantly more risk for blinding conditions like retinal detachment, glaucoma, cataracts. In fact, studies show that a normal length eyeball, so we measure the length of the eye in what's called axial length, it's measured in millimeters. So an average eyeball is roughly 26 millimeters or less in length. The risk of permanent visual impairment at age 75 or above is only about 4% for someone with a normal eyeball. In myopic people, we have longer eyeballs, and so when you enter those axial lengths of about 26 millimeters or above, the rate of permanent visual impairment at age 75 goes up to 25%. Now, really high prescriptions, 30 millimeter axial lengths or higher, the rate of visual impairment at age 75 goes up to 90%. So it is so important to keep the eye from getting into that really, really high axial lengths and those really, really high prescriptions. Not just to keep your vision clear, but to make sure that you have healthy eyes that can see well for your entire life. And the only time we can slow down and stop those kind of changes is during childhood. That's why it's so important to address the issue today while it's happening and not wait until you're 75 and unable to see.